Hello, I'm Dr. Ross Walker and welcome to the checkup.
Hello, Dr. Ross Walker and welcome to the checkup. I'd like to continue my series on cholesterol now by talking about the treatment of cholesterol. So if you do need your cholesterol lowered by a high calcium score or existing heart disease, statin drugs are highly effective. They do lower your cholesterol. You're on them for the rest of your life. And the problem with statins is that, yes, they're effective at lowering cholesterol, but they may damage your muscles. And about 20% of my patients get problems with muscle pain, stiffness, weakness, cramping, and even loss of muscle bulk. 20% of people, especially who take the fat-soluble statins, that's atorvastatin, Lipitor, simvastatin, Zocor, get problems with memory, concentration, depression, fatigue, anxiety, irritability. They don't sleep well. There is a significant increased risk for diabetes on these drugs, may affect the liver. So there's a lot of different things they can do, cause other side effects as well. But if they don't cause side effects and you're at high risk for heart disease, it's a good management of your cholesterol for those sort of people, but only see it as 10% of your management. 80% of your management is, of course, lifestyle, 10% of the statins. But if you do have side effects from the statins, we are getting newer alternatives coming through all the time. Coming out in the next year or so is a drug called bempedoic acid that works beyond or just below the typical statin enzyme, and it doesn't cause the aches and pains or some of the neurocognitive problems that statins do. So that's coming out pretty soon. That's an oral drug. Right at the moment, if you're at very high risk for heart disease, if you qualify for this, and there's a set of rigid criteria you have to suit to get this treatment, you can have a once a fortnight injection of this monoclonal antibody that does plummet your cholesterol. It's highly effective, reduces your cholesterol around 50%, but it's a fortnightly injection. And if you're a trypanophobic, as I said a few weeks ago, that certainly may be something that would put you off having these treatments. And I'll get on to the future of medicine in another podcast coming up pretty soon. But interestingly, a few weeks ago at the European Society of Cardiology meeting, they released a study on a drug called inclisiran, which works on what we call the small RNA molecules in the liver. We know about the RNA vaccines for COVID. So this works on the small RNA molecules in the liver, and you only need this injection once every 6 months, and it pulverizes the cholesterol like the PCSK9 inhibitors, the monoclonal antibodies that I spoke about before. And I think that's doable, an injection every 6 months. It's been shown that if 300,000 people received this inclisiran over the next 3 years, it would prevent 55,000 heart attacks and 30,000 deaths. So it's a pretty powerful treatment. And if you are if you are able to take a statin, if you add statin to inclisiran, you can reduce your cholesterol down by 80%. So rule of thumb is a 50% reduction in cholesterol leads to a 30% reduction in cardiovascular events. So in people who do have cholesterol issues and proven muck in their arteries, vascular disease or a high calcium score, it is important as part of your management to lower your cholesterol. So that's the checkup. We'll talk more next week. Thank you.